Good morning, everyone, and welcome to day 2 of the 2023 BC Digital Health Forum, inspired by Canada Health InfoWay's Digital Health Week. This week's forum is a continuation of the national celebration, where we get the opportunity to dive deeper into the world of digital health here in British Columbia and explore the exciting possibilities at the intersection of healthcare and technology. Yesterday was a fantastic start to the forum, and we're looking forward to continuing to showcase how technology can be a lifeline, connecting patients with care providers when physical distances and resources are a challenge, and new ways of interacting with healthcare are truly upon us. Once again, we have a fantastic mix of students, patient partners, healthcare and technology experts and professionals, and many more joining us today, highlighting that teams from across PHSA and the wider healthcare system in BC have come together to bring you a week of amazing events, both virtually and in person. Those teams include the PHSA Provincial Digital Health and Information Services Portfolio, the BC Ministry of Health, the Women's Health Research Institute at BC Women's Hospital, BC Children's Hospital Research Institute, BC Healthcare Information and Management Systems Society, or HIMSS. We also have a couple academic partners this year, specifically the University of BC and the the BC Institute of Technology, BCIT. My name is Tina Costa, and I'm a director with the Office of Virtual Health. I have the honor and pleasure of being your host again today, and to be joined by some of our very talented planning committee members. These folks continue to do a lot of amazing things in the background, navigating issues that we learned about yesterday and fixing them on the fly. And so if there is any support that you need, you'll see their names coming up in the chat. Look out for names of Cecilia, Amanda, Sonia, and Sarah. To meaningfully ground our discussion on the second day of this forum, I would like to invite each of you in our virtual circle to take a moment to acknowledge with deep gratitude that we are joining today from many different traditional, ancestral, and unceded territories of BC First Nations. As a white settler, I acknowledge that I am an uninvited guest on these lands, and that I'm participating today from the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations, colonially known as Vancouver. In our conversations about digital health advancements and innovations, let us carry forward the importance of recognizing the traditional custodians of this land as we continue to engage, learn, and collaborate in the realm of digital health. Let us give thanks for the privilege to do so on these beautiful and sacred lands. May our discussions contribute to a future where Indigenous voices are uplifted and the principles of reconciliation truly guide our path forward. Before we get right into our presentations, there are just a few things I'd like to highlight so you can take advantage of the participation as best as possible. We do have a number of accessibility features enabled to support an inclusive environment. You'll see some information about that come up in the chat for those of you who need it. And you can find, and if you need support around that, please do so, mention it in the chat. In terms of sending in your questions for our presenters, please use the Q&A icon in the main window. We'll also be gathering your overall feedback throughout the day using polls at the end of each session to help really elevate the event throughout the week and in future events. We continue to have opportunities to interact and win. So if you haven't had a chance yesterday to check out the contests throughout the week, that they're highlighted on the FeedLoop Go app or on the website. As mentioned previously, we're proud to host a variety of sessions for you during the week-long celebration, and we'll paste a link in the chat for you to explore out many of the other events. And again, just lastly, if there's any of you that are unable to attend the events, don't worry, we do have you covered. Things are being recorded and they'll be shared post-forum and available online. We'll let you know where to find them. Okay, it's now time for me to hand it over to our first presenters of the day. We have three presenters, including Neel Majumder, Nick, Milton, and Maanash Saamal. Neel is a senior leader with PHSA's Provincial Digital Solutions, overseeing the analytics and product management portfolios. With a background in digital health technology design, implementation, and adoption across major Canadian organization, Neel's passion is to drive transformation changes in healthcare technology and mentor emerging health informatics professionals. Nick is a virtual health professional with a background in software development and business administration. He joined PHSA during the pandemic to work on the implementation of Zoom for virtual health across PHSA and other health authorities in BC. In his current role, Nick has led the move of virtual health databases to the Azure cloud as part of PHSA's data strategy. Maanash is a seasoned BI and analytics specialist with over a decade of expertise in transforming raw data into strategic insights. His journey began as a data enthusiast, evolving into proficient analyst and strategist, designing robust data architectures to implementing cutting-edge analytics solutions, deciphering complex data sets, uncovering hidden patterns, and crafting actionable strategies for organizations across diverse industries and bridging the gap between technical intricacies and strategic business objectives. He is a passionate AI enthusiast, always at the forefront, evolving and integrating artificial intelligence into his analytics toolkit. He believes in harnessing the power of AI to drive change in the healthcare system. Please join me in welcoming Neel, Nick, and Maanash on their talk on measuring success for digital health products, a metrics-driven approach. Thank you. Over to you.
Thank you, Tina, for the warm welcome. While we're trying to get set up with the slides, I'm just going to get started. Hi, and good morning, everyone. Thank you all for joining this morning today. On behalf of PHSA's Office of Virtual Health, the Data Intelligence and the Evaluation team, we are very glad and excited to be kickstarting day 2 of the Digital Health Forum 2023 by sharing our experience of data management and creating actionable insights to empower digital health product success. The next slide, please, Matt. Yeah, so let's take a moment to read and reflect on the land acknowledgement that we see out here. And if you are joining from other parts of British Columbia, please feel free to share your land acknowledgements in the chat while we move on to our next slide. So this is the outline of the story that we are going to share with you in the next half hour. And we are going to start with some of the challenges and pain points that the team has encountered over the last few months, and also the opportunities that the team had in front of us. And with all of this context of problems and opportunities, we landed on a vision and a concept of a data-driven product analytics platform, which also resulted in a shift in the way that we have been trying to look at our data assets. So we are very pleased to share with you our journey and experience, and also lessons learned in the process. And we will also have a sneak peek at our data visualization platform, the cool and fancy dashboards that we have come up with. And at the end, we are planning to wrap up with a future roadmap of what we are trying to do, hoping at the end we are going to have some open time for questions or comments from the group. So we are going to start with the problem statement that we encountered. The next slide, please. So for some context for this group out here, Office of Virtual Health receives a lot of utilization and activity data from a range of our PHSA partners that we work with. And those data are related to primarily the multiple provincial virtual health platforms like Zoom for healthcare, virtual health visits, remote patient monitoring, virtual remote interpreting, toxic drug and health alerts, and etc. So as the data intelligence team at our Office of Virtual Health, we are primarily responsible for generating the insights on adoption, utilization, and user experience on all of these platforms. And we do that in the form of the reports and also interactive dashboards, which is distributed to our partners as across the province. And also some of the insights that we generate here through the data that we have feeds into a range of business cases and evaluation plans for virtual health solutions. What we see in this slide is a little bit of snapshot of our reporting volumes, which has for sure seen an upward trend in the last few months, thanks to the escalating data volumes and diverse data sources that we have access to so far. So one of the challenges that we have seen while dealing with the data in the past few months is our approach has been a little bit reactive, and which resulted in a development of a lot of ad hoc reports and dashboards, which didn't find a continued use over a period of time. And this was really topped up by suboptimal data management practices, due to which we are really unable to uncover and unlock the real potential of the data asset that we had access to. The next slide, please. So adding on to the challenge of working in an unstructured and inconsistent data environment, which I just alluded to, was the increasing number of virtual and digital health products that OVH team has been supporting in various ways, like product conceptualization, development, launch. And we do this in close partnership with PHSA network organizations and also other health authorities. Some of the products that you will hear a little bit more about in some of the sessions in this week include the PCICCN Long COVID Web Portal, the PSBC Perinatal and Newborn Hub, that is a knowledge portal as well, and also the BC Digital Health Atlas. So in context of all of this increasing product portfolio that we have been experiencing over the past months, and also we were having access to a lot of new data sources and increasing data sources. And this has been one of the key drivers for us to really improve and optimize our data intelligence setup that we had before, so that we will be able to provide and support evidence-based decision-making to optimize the success of our digital health products. The next one, please. So while thinking about digital and virtual health product success, these are the ones that you see in this slide. These are some key considerations that the team brainstormed on, and which has been like our North Star in determining what metrics to track and why. So usability has been definitely one of the most obvious ones, since our healthcare users and our patient community are the sole reason that we build all of these digital and virtual health products. Understanding their feedback on the ease of use, the interface of the platform that the product has, and the trends in acquiring new users and the engagement and the retention has been one of the key foundations for measuring product success. Also, just from a technical standpoint here, we wanted to measure indicators like platform performance, reliability, compliance to required standards, and this also had a very important role to determine the product success. So the next two that you see down below, so these are value and viability. So this is something which we wanted to measure not in the near term, but in the longer term. And also from a viability standpoint, the product fitness is something which we thought is very important for us to measure. So the organization, since we wanted to make sure that the virtual or the digital health product fits seamlessly to the organization's strategic goals and objectives. So overall, in our recent experience, we're working with a product management approach and with a variety of digital health products that I just showed you, we found getting data on usability and technical feasibility was slightly easier due to the tangible nature, while collecting data on the metrics on value and viability may be considered a little bit of medium to long term, because these were not very easy for us to really collect the data. Now, the next one. So we are going to jump into the vision statement here. So with all of this context that I just shared, the problems, the opportunities, the challenges that we had, our team went through multiple cycles of brainstorming, which helped us really land on a common vision of creating an inclusive data intelligence platform that can empower digital health product success through informed decision-making. Some of the core components of this vision, as you can see here in the slide, has been to focus on generating end-user centric metrics and insights, and treat data as a strategic asset, adopt a product-driven approach. And last but not the least, we wanted to create a robust technical platform which could be scaled on demand. So our idea behind the vision has been really to reduce the distance between the data and the product team so that they have access to actionable insights, the time that they need, that lead to really improvement and optimization of the digital health product success. The next slide, please. So once we crafted our vision, so the next logical step for us was really to understand the data lifecycle and the area that needed to be optimized in order for us to unlock the maximum potential of the OVH data assets that we had access to. So as you can see in this graphic out here, so the outputs from a data analytics team usually is artifacts like reports, dashboards, and also paginated reports, which is usually what the external world sees. But as they say in the data world, and maybe some of you have heard, if you put garbage in, you get garbage out. So which signifies that we had to spend time in streamlining the data processing and the quality assurance to ensure we provide high quality inputs to our data visualization platform, which could lead to some real good actionable insights. So we started with creating an inventory of data sources that we have access to and streamlining the data management practices, more of which you will learn in the slides that we have there. We created a data dictionary and data models, which is the back end, but very important to ensure that the work, to ensure that we realize the vision that we set out for. The next one. So we wanted to design a minimal viable product of our platform, which is in sync with our current levels of data maturity, and also have an understanding of the future roadmap in terms of the maturity levels. So this graphic that you see out here is sourced from some of the industry best practices. It provides a snapshot of how much can be done with the data assets that you own as an organization. At a very foundational level, raw data can be cleaned and pre-processed to produce reports and dashboards on actionable insights on the hindsight, which is what we are doing at this point of time. But really the vision for us is, as we get to a more mature state, our plan will be to incorporate complex algorithms like artificial intelligence and machine learning models to do a more deeper dive into the data assets that we currently own. So here, I'm going to pass it over to Nick from here to discuss the shift that we went in order to realize our vision of having a data analytics platform for products. Over to you, Nick.
Thanks, Neel. So in this section, I'm going to explain how we had a shift in mindset and essentially a new approach to affect this change that we wanted to come about. So we're going to start, well, we started at suboptimal data management. This is essentially like a ground-up approach that focused on data first, and it makes it difficult for data to fit in the overall vision from leadership. It was also difficult to communicate the significance of individual pieces of data or even tables, since you're trying to add it to a yet unknown model. We're also assuming that the end user who looks at the data has the expertise to understand where these fragmented pieces fit, essentially putting the work on the end user. So going to the diagram on the right, we move to a more top-down approach, which requires all these pieces to fit together. I'll just go through the first two. So optimized data collection, for example, there's no guessing what data we need, and then just like collecting as much as possible. We need to know right away. With robust data processing, knowing the end goal, we can be focused on like the product, and so we know how to process this data as part of the whole approach. Next slide, please. So if we put all those pieces together, we should see these benefits. Again, I'll only go through the first for time's sake. Hopefully we should get a faster delivery of product analytics. So like there's less time dealing with unnecessary data and sharing unfocused insights. Next slide, please. So with all that theory and change in approach, I can take you through our actual progress. So we start at an initiation phase, which is similar to most projects. We move on to then the assessment phase, which you'll see a lot of the theory for in this presentation. Maanash can take you through the assets and the data sources, and I'll take you through the metrics in detail shortly. Next, we have our define phase, where we take a deeper dive into the design of the product. And then next, after that, we have the development phase, or the develop phase. This is where we start a cyclical process of continuous improvement. We are currently at the create prototype phase. After that, we get stakeholder engagement. We reflect on the feedback and refine the solution. So this is a cyclical process where we implement change according to feedback. This moves on then to the implement phase after that. So again, it's another cycle of getting feedback, making changes. So there's continuous improvement. And then it moves on to the monitoring phase, which again is the same cyclical process with slight adjustments. So when you look at this develop phase, implement phase, and monitor phase, you can think of it as being in the dev, test, and prod environments. Next slide, please. As I mentioned previously, we need to define the metrics categories. So there are the broad buckets in which all the metrics will fit into: adoption, retention, engagement, user experience, and usability. Next slide, please. So within those broad buckets, we have these like frequently used product metrics or key performance indicators. These are standardized across our products, so it'll be easier to compare the products, and also with the standardization there comes like it's a standard process, so it's quicker to get through. We build expertise, that sort of thing. The first one, as I'll just take you through, is just page views. Everyone should be familiar with this. And then unique page views, so just the unique users that we get visiting a page. So next slide, please. So this slide shows the Zoom for Healthcare virtual health visits survey. So this is an output of our product focus approach. This first slide focuses on like the patient survey. So at the very top, you can see the clearly defined like patient outcomes, which are quite easy to understand. In the bottom left-hand corner, we highlight a change from the 2021 survey to the 2022 survey. Next to that, in the bottom middle, we see the total travel distance avoided. This is a really important indicator, as it's one of the biggest benefits to the patient for using virtual health visits. And then in the right-hand pane, we highlight some of the barriers. So this is really important, just to communicate the issues that need to be worked on and improved to continuously improve this product. So next slide, please. As part of this same survey, we also surveyed the providers. So again, at the very top, we've got these outcomes, which are easy to understand. Below that, again, we've got like the difference between 2021 to 2022 surveys. And then again, in the right-hand pane, we have the barriers for the providers. So these are issues that we need to improve. So everyone's clearly aware of what we need to work on. Next slide, please. And then in our last case example, we've got quite a new product. It's the long-term COVID evaluation. So with this one, we're closer to the KPIs that I've shown you previously. You can see how like the product is referred, accessed, and what resources are most sought after. And since this is like a standardized approach, we can compare this to similar products at this stage in their development, and so we can determine success at whatever stage they're at. Next slide, please. So with that, I can hand it off to Maanash to talk about the prototype.
Yeah, thank you, Nick. So now onwards, we will discuss more about the engineering piece of all this effort, how exactly we achieved this, and what's our architecture of data flow. So this is one of the previous architecture what we used to use. That is where we have a specific data source set, then we have a staging layer, then analytics. So the downside of this particular architecture was we are not able to stage our data on a specific data structure or a specific data lake, which restricts us to reuse the data in multiple data sets. So that's where we decide to take more cloud-centric approach. And we came up with a 4-stage approach. Like the layer 1 is the data sources. So currently we have been working with more than 11 data sources, but we have driver for almost 300 to 400 data sources. That includes databases, APIs, open-end data sources, web architectures. Everywhere we are collecting data from all possible sources. Then we are integrating all those data to one of our data lake, which is again cloud-based in Azure, and we are creating various data segmentation on that. So that concludes our data integration part. Then from the data analytics part, we are doing all of our data analytics using Azure services and Power BI services. Then once we cleanse the data, then we push that to our BI data models, which are pretty data-centric approach, like a star schema and extended star schema, pretty robust models where we can reuse the data. And finally, we push that to the final reporting layer. And on top of the reporting layer, we usually create all of our dashboards. So most of the reporting layers are reusable, secure, and secured by cloud architecture and all compliance requirements. So all this system what we are looking at are completely live through data gateways and direct data feedback loop. And we are managing all this reporting practice on Microsoft Power BI on premium capacity. So it is auto scalable as well. So predominantly the entire platform is auto scale, robust, and secure. Now, in order to give you the demonstration on the platform, I am taking you to the actual platform where we have created this. So this is a prototype. So this particular prototype is pretty intuitive. And what we did, we divided all of our reporting requirements or all of our data sets or all of our data practices into 6 different categories, starting from synchronous interaction, asynchronous communication, clinician to clinician communication, remote patient monitoring, patient self-management, and care coordinations. So all of our OVH and digital health practices or all of those insights can be found in one of these sections. So today we are going to discuss 2 of the important prototypes, that is Zoom, that Nick already shared. So this is the way we can interact. We have to go inside one of the category and we can view whatever the data insights we want. For example, in Zoom 2022 survey, if you go inside this report, then we can interact with the report from a different category perspective, survey overview, patient experience, and here we integrate a lot many datas from survey, patient data, then clinician provider. So this is the way you can interact with the report. So this is our platform basically, and yeah, we can get more insights from this platform. And I'm handing it over to Neel for our next slide.
Yeah, sure. I'm just going to do a very quick 20-second wrap up here. So thank you very much, Maanash and Nick. Very briefly, next steps. Next slide, Maanash. We are just going to, so really the next steps in front of us is we are going to continue working towards realizing our vision and work towards a more inclusive data strategy that encompasses all the PHSA digital and virtual health products. Thank you all for listening. If you have any comments or question, happy to take it now.
Wonderful. Thank you, Neel, Nick, and Maanash for starting our day off with all things data. Really showcases the importance of how having that clear vision and that approach to ensuring the data that we're collecting, particularly from all the different technologies that we're introducing into healthcare, are of most benefit. So really appreciate your expertise in this area. Unfortunately, we don't have time for questions, but I certainly would encourage anyone looking to tap into these brilliant minds of our data experts to reach out to each or all of them. So thank you to our speakers once again. We are going to close the session now. And just for those who aren't familiar with the process in terms of the next session, that we are going to deploy just a quick poll right now to get your feedback on the session and provide some insight for planning for next year. And as you're doing that and wrapping it up, we'll invite you to our next session, which is entitled How a Text Messaging Platform Can Impact Care in a Pediatric Cardiology Clinic. And you can navigate to that next presentation by you have to go in and physically click on that session title on the panel on the left-hand side of your screen. And so we hope to see you there. Again, thank you so much to our first presenters of the day.